what we're realizing as pediatricians or as healthcare providers or really generally within the healthcare system is that it's no longer enough to just care for the one child or the one person in front of us, but to think about their family, the community, and the larger systems in which we operate. Think about how we are helping to coordinate care, not just medical care, but these other issues that are coming up around housing, around transportation, around work and income and stability in terms of finances.
Why is addressing social determinants of health important in your role and to your organization?
It's important for us because the population that Howard typically serves are faced with these social determinants of health. And then the population that we're actually training are typically individuals who have a similar background as the people that they're serving.
For us at HSC, part of the work that we're doing is trying to create success for the family and independence for the child. And so to do that, we really have to understand the complexity that the kids that we're working with and the families that we're working with have. Think about how you think outside the lane of medicine. Medicine is no longer just about writing the prescription or taking care of that child who's in front of you, but what are the barriers to care that are not allowing that child to really maximize their potential? We actually see the failures of the systems as they sort of start to fall out of the pediatric space, where they get help from school and they get help from their pediatrician and they get help from all these child serving agencies. But when you look at the population of individuals with disabilities, it's an even harder transition because there's so many administrative barriers that they need to get through.
Can you talk about your work pushing insurers to get out of their own lane and incentivize different forms of payment for services?
That kind of the light bulb went off and they said, oh yeah, these things like pest control and healthy food over a longer course of time than just post-discharge from the hospital, these things actually do make a difference in healthcare, and we see kind of the linkage, but it's taken us a while to get there.
I encourage all of you and companies to really roll up your sleeves and do the work to understand what kinds of jobs are we really providing? Are we really meaningful explaining that to the local community and youth?
We're making strides, but still have a lot of work to do in really understanding the needs of our communities and in really assessing the interventions that we start.